My name is Avital Leibovich, and I'm the director of AJC Jerusalem. Welcome to Advocacy Anywhere, powered by AJC. Advocacy Anywhere is AJC's new digital platform that will enable you to engage with AJC's global expertise, content, and advocacy from wherever you are. With its flourishing science and technology sector, Israel is on the cutting edge of medical innovation. As the novel coronavirus, or COVID-19, sweeps the globe, Israeli doctors, researchers, and entrepreneurs are working diligently to help find a cure and improve treatment options. Joining us today to discuss these efforts, as well as the country's own strategies to prevent the spread of the virus, are Dr. Daniel Landsberg, who serves as Regional Medical Director of Maccabi Health Services, and Dr. Kira Radinsky, Chair and Chief Technology Officer of Diagnostic Robotics. After we hear from Drs. Landsberger and Radinsky, we will take your questions. You may email your question to questions@ajc.org. Questions is plural. Or use the Q&A chat feature in Zoom. Dr. Landsberger, although the coronavirus spread to most of the world, including the US and Israel, there are major differences in the approach of the two countries. Could you please share with us how Israel is handling the current situation? And additionally, can you elaborate on the concept of community medicine? Is it an efficient approach in handling the corona crisis? Please.
Sure. So I think I'll just launch in by explaining to people who are waiting. I'm sure everybody is probably pretty saturated with the news, but just to put into perspective where we started off. In December of 2019, a coronavirus outbreak was announced in the Wuhan province of China. By the end of December, China had already declared a type of epidemic. On the 30th of January, which now seems to me, being involved in this so much already, ages ago, but on the 30th of January, there were actually only 170 deaths in China at that stage. Of course, by now, we have over 3,500 deaths in China, but at that stage, there were 170. Israel was one of the first countries in the world to decide to stop air links with China, and all flights to China were suspended. And from there, maybe to explain the Israeli strategy of dealing with it. It's important to understand, however, the medical situation in Israel. Israel, of course, is a country of about 8 million people, not much compared to the United States. We have 4 health maintenance organizations, which essentially deliver all the community health. And the HMOs, what we call in Israel, Pot Cholim, are responsible for all the healthcare delivered in the community, from well baby care, vaccinations, medications, pharmacies, family physicians, pediatricians. Everything which is done in the community is handled by the HMOs. And we are all funded by this in the same principle. Israel has a social health system, and we're funded by a health tax which is gathered from every citizen. So basically 100% of Israeli citizens belong to one of these health maintenance organizations. Overseeing all of us is a health ministry, and there's a minister of health and a director of the Ministry of Health. And basically, we get policy directives straight from this ministry. As I said, I think we'll maybe discuss a little bit about how the country started reacting to the coronavirus outbreak, and then maybe how we personally did it. So, as I said, Israel started already with one of the first countries in the world to cut air links with China. This was considered a very drastic step. We have a lot of trade links to China, but this was considered necessary to stop the spread of the virus to Israel. And mandatory quarantine was put into effect for all people returning from all Israeli citizens returning from China. Quite rapidly, this air quarantine was extended to other countries: Korea, Taiwan, Singapore, Hong Kong. And over the next few weeks, we saw restrictions slowly being performed on people returning from different countries, including Western Europe, when it started to become evident that there were cases coming out of Italy and Austria. This was very controversial in the beginning. It wasn't well accepted by the public, including myself, who found myself, I was eventually in quarantine for a week, having returned from a holiday in Austria. But as a result, we saw very few cases in Israel in the beginning. There was 1 or 2 cases, and the virus has been very slow to develop in the country. At the same time, the health organizations started preparing. And this is one of the big issues and one of the strengths of Israel, because we really are a country with a lot of centralized control of the health system. We basically all got a directive to prepare. I'll give you examples of how the country has been preparing over the last 5 weeks already. For example, even before there was even one patient in intensive care in any hospital, all medical staff were forbidden from traveling overseas. So we all had our holidays and conferences and everything canceled. None of us, no doctors, nurses, physiotherapists, no one is allowed to travel overseas. We've all been basically restrained to Israel. And this is quite a strange thing to happen in a democracy. I don't think this has ever happened in the past in Israel's history. There was a little bit of disconcern and some mumblings of certain doctors, but in fact it went down very well, even though a lot of people might have had their holiday plans cancelled, etc. And immediately after that, for example, I'm in a position where I'm responsible for an area of 500,000 people. We started having initially weekly meetings with the health ministry to be brought up to date and to start preparing for what was thought to become. Now, this all sounds strange. We still didn't have any patients in Israel. We had 3 or 4 come back from that famous cruise ship, the Diamond Princess in Japan. But we didn't really have any patients, and we seem to be doing a lot of preparations for nothing. And maybe that's an important message to you in America, is start preparing. This is coming, and when it comes, it's going to be big. And so the type of things that we've started preparing was how are we going to deliver healthcare to people who are going to be stuck in their homes? How are we going to deal with sick people? And much more sick people than we're used to dealing with at one stage. What are we going to do with our staff? We've got staff who may be themselves sick, etc. Stockpiling equipment for protective gear. If you're going to treat a corona patient, you have to have protective gear. And all this has been going on for the last few weeks, and I can say maybe just in time, because the increase in the amount of patients sick is now increasing exponentially. It's difficult to understand sometimes, but the coronavirus, every person with coronavirus can potentially, on average, infect another 4 people. So if you start off at the beginning of the week with two people, and if it doubles every 2 or 3 days, you've got 4, 8, 16, and basically by the end of the month, without realizing and thinking that you've only got 4 or 6 patients, by the end of the month, you can have 10, 20,000. And the next month, you're going to have 100,000 or even more. In fact, it is the World Health Organization estimates that if we don't do anything to prevent the spread of the disease, about 30% of the world will become infected by the end of the year. Although, a word about Italy. Italy is not very far from Israel. It's about a 3.5 hour flight. That's Houston to New York. In Italy, they've been very hard hit by the coronavirus. To date, they've had 2,900 deaths already there, which is really, really a lot. And Italy has got a very well-developed medical system. and it has basically been completely overwhelmed by the virus. With regards to, I think, a couple of words about the differences maybe between Israel and the United States, certainly, and a lot of other countries maybe. As I've said, we have a socialized medical system where every person is entitled to health care. The other side of the flip side of that is that we as a health maintenance organization are responsible for hospitalizations, certainly for the payment of hospitalizations of every one of our patients. So we've got a very strong interest in making sure that the community stays healthy and doesn't end up in hospital, because that's, other than, of course, the health burden, is also a big financial burden on us. The next thing which is different about the Israeli health system is because of the quite hierarchical nature of it. It's pretty easy to give orders, to give instructions. From the time that the Prime Minister decides on something, he passes it down to the health minister, and within an hour or two, it's already on my desk. It's highly unlikely that this is going to be challenged in Congress. We don't have Congress, we have a parliament. It's highly unlikely that the courts will challenge this. And basically, we can get the job done and going within a few hours. Sometimes by the next day, we've already changed our programs. I don't think this can happen in a country like the United States with so many states, governors and mayors, and the health system in the United States is much more fragmented. And so in a way, you've got a much bigger headache than we've got just to try to control the whole process. The second thing, I think, which is a big difference between Israel and certainly certain countries in Europe, is the high regard we have here to the sanctity of human life. You know, in Judaism, we say ad mei esrim, until 120, and that's considered a blessing when you wish somebody that he'll live until 120. In some countries, it's considered almost a curse to wish somebody to have such a long life. And maybe also because of the wars which we've been through, and of course the history of the Holocaust, we're very, very sensitive to what we consider being a threat to our existence. Now, and I don't want everybody to be too panicky. Coronavirus is not going to threaten the existence of the world. A lot of people are going to be sick, and quite a lot are going to die, unfortunately, especially if you're elderly and have coexistent diseases. But it will pass. It will pass in a few months' time. But in the meantime, a lot of people might die. And we're very, very sensitive to this. I know some countries in Europe have said, you know, well, this is inevitable. Some people will die, some people won't, and the economy, you know, is more important. That's not our attitude. The other difference in Israeli society is that a lot of people have been through the army. So we're quite used to these sort of strange rules and emergency situations. We've been through wars, we've been through missile attacks. And so it's not so unusual for us to receive orders from our government, stay inside, don't go outside. And people in general tend to listen. It's not absolute, but they tend to listen. And I think the final thing which you should know about in terms of why we're being so prepared, other than that, is that although the community health situation is excellent in Israel, in fact, the World Health Organization says we have one of the best community health services in the world, our situation in the hospital is not as good. We have very few hospital beds per 1,000 people. In Israel, it's 2.4 beds to 1,000 people. In Japan, for example, it's over 7 beds to 1,000 people. So if we get a lot of sick people in hospital, we're just not going to have enough beds for them, and people are going to get into trouble just because we can't treat them. And that's really why we've been preparing. Avital, if you have any questions.
Yeah, I think, thank you, Dr. Landsberger. I think we'll stop here because I am anxious to ask you, but I do want to turn to Dr. Kira Radinsky beforehand. Kira, Israel is famous for its innovative spirit, I would say, and you have been a leading researcher in an exciting first of its kind project. Can you please explain to us about the technology you developed, how it's supporting the current challenge, and how the Ministry of Health became also a partner of yours for this project?
Wonderful. Thank you for the questions. So I'm one of the co-founders of a company called Diagnostic Robotics. I co-founded it with Professor Moshe Shom and Jonathan Amir. And we started the company first, try to build automated AI systems for triaging patients in emergency rooms in order to reduce the loads inside emergency rooms. Over time, we started working with different hospitals in Israel, started collaborations with hospitals in the US, with mostly Maimonides and Mayo Clinic. And then with time, we realized that we can also bring value and start triaging from the community. So we started working with the different HMOs here in Israel, and recently started collaborating with different payers in the United States. Last week, Israel government decided to start taking digital triaging and spread it on a daily basis for the entire population to start monitoring. The idea is to identify patients who are starting to develop symptoms of coronavirus by a set of systems that are actually calling them or texting them. They're going on a clinical triage. Additionally, we're getting ready for hospitalization at home. So people at home and hospitalized, we want to make sure that we can identify deteriorations. All of this information is eventually being delivered as red flags for the different HMOs, 911 services here in Israel. And on a population level, healthcare, we're actually providing a heat map of where the virus is right now and actually building AI system to predict how is it going to spread. All of this information is going to be very vital to make better decisions, understanding around which areas should be in isolation, which ones need more attention, which ones we can actually reduce the isolations in them, etc.
I would like to ask you, is this project, which sounds to me quite something that could make a revolution here, is this project you think that the international community could benefit from, and if so, in what way?
So we're actually reaching out to whoever needs our help. Everybody who can use our platform for triaging, we're here. Feel free to contact us directly. We'll be glad to share it, including the knowledge that we started gaining. We see the information over time as well, so we can start learning about the disease together. So everybody who's listening here and needs access in any way, please do contact us.
That's great, because I'm sure we do have a lot of AJC folks who have a lot of contacts and maybe even interested in helping promoting this project. Before I turn it over to our listeners, just one additional question for you, Dr. Landsberger. So having heard your description and actually this very unique kind of system we have here in Israel, what would you say are the one or two major lessons that the U.S. can learn from Israel's experience in the current crisis?
Sure. So firstly, just a remark that what Kira said earlier, it's very important to track where the cases are, because the most effective thing for preventing spread is to isolate people who are sick and separate them from other people. And the contacts. So the mapping is crucial. I think the first thing that we can learn from the Israeli experience is that it's important not to ignore the threat. It's coming. You've got to believe it's coming, and you know, don't ignore it. That just because you can't see it, it doesn't mean it's not there. And by the time you're aware of it being there, it might be too late. So start preparing. Start preparing doesn't mean you need to stockpile on toilet paper. I mean, for some reason, this is a big thing all over the world. I don't know what's going on with that. You don't need to. Supermarkets are not going to collapse. But what I mean by preparing is to make sure, you know, this is a disease which affects especially the elderly. So make sure that your parents are going to be able to cope with being maybe alone for a few weeks, that they have their medications, that they have lines of communication clearly with their primary caregiver, their doctor. That's on a personal basis. On a countrywide basis, you've got to start preparing the medical teams. The medical teams have to realize that they're going to go through a quite difficult period, and you need to start thinking about how you're going to be protecting your medical teams physically and mentally, because they're going to be dealing with a lot of sick people. On a government level, You need to mobilize local government. You've got to decide what you're going to be doing when you find sick people, where you're going to keep them. A lot of people aren't that sick. A lot of people have just got a little bit of a cold and a cough, but you don't want them going around spreading the disease to other people. So how are you going to explain this? And I think what Israel did, which I think is unique, and I think, in fact, the United States could quite easily adopt it, is you've got to have good people in authority convincing the population to do what has to be done. And this isn't always politicians. You know, politicians, sometimes people are a bit skeptical that they've got alternative motives. It's better to have a really good medical personality, scientist, who can, in a simple way, explain to people what the facts are without creating panic and make people accept the right and logical decisions. And you've got to keep people updated all the time. And updating is not necessarily, you know, what's on the news broadcast of the evening. They tend to sensationalize things. You need to have good public education, and it needs to be done now already. You have to do it quick.
Right. Thank you so much. I think it's time now to get your questions and interesting things you would like to ask. Ali?
Sure. Yes, thank you so much, Avital. We have a lot of great questions coming in, and a reminder that you can email questions, that's questions plural, at ajc.org to ask a question, and you can also enter your questions in the Q&A box in Zoom. So the first question comes to us from Flor Feldman of Berkeley, California, and this is a question for Dr. Radinsky. Dr. Radinsky, is there a role for 3D printing in helping to create masks and address the shortage of other medical supplies?
So definitely there are several companies who are doing this. Today, just from a scale perspective, we need to mostly focus on isolation. This is what most governments and health agencies are actually coming to. So my personal belief is that focusing on digital systems to try to tackle the problem of identifying people with coronavirus very early before they spread it and isolating them, this is probably the best next action.
Great, terrific. The next question comes from Joe Renee Fine in Palm Beach, and Joe wants to know, Dr. Landsberg, are there people in your jurisdiction who are part of the Haredi community, and what can you say about some reports that some members of the Haredi community are ignoring some of the social distancing rules? Have you found that to be the case?
Well, yes, I think it's a combination of several things. Firstly, especially our organization, we're highly digital. You know, everybody has a smartphone, everybody has an app which he can connect to his own doctor. In fact, 80% of our patients have direct contact with their doctor through an app, and they don't even have to see their doctor. In the Haredi community, there's a lot. It's the usage of smartphones is much less for various reasons, religious reasons, and others. And so the lines of communication are not as good, and maybe we haven't been as good educating them. That's the first problem. We just haven't been as good speaking to them. In fact, the local municipalities have started sending sort of these trucks around with making public announcements to try to explain to people what needs to be done. The second problem with the Haredi community is you know, religious community, a lot of importance is given to ritual and you know, weddings and bar mitzvahs, and all these things have been happening even though there's been a ban on gatherings of more than 100 people. This hasn't been strictly observed, but I think, you know, this is something which is developing, and I'm pretty sure by next week this will be observed. The other problem is studies. You know, study groups are sometimes very big. All conventional studies, you know, universities, schools have all been closed, but some of the religious seminars, you know, we call the yeshivot, the cheder, they have not been closed. And there's been a bit of reluctance, even at the government level, to do this. Personally, I think it has to be done. It's to save lives. It's pikuach nefesh. We have to do it. I'm pretty sure by next week this will be enforced.
Terrific. We have several questions coming in, a lot on one topic in particular. There have been reports that Israeli companies are really hard at work on a vaccine. And I'm wondering if either of you would be able to share what you know about the status of a possible vaccine coming out of Israel.
Sure, I can give, and Kira wants to add. There is a company in the Galil called Migal. It's a small private company. For many years, they have been working on a coronavirus vaccine. Coronavirus is a very common virus. In fact, every one of you has probably had a coronavirus infection at some stage in their life. It causes the common cold. But coronavirus can also cause serious illness amongst poultry, chickens and turkey especially. And they've developed a vaccine for use in these animals, in birds. And they feel that within a few, maybe months, maybe weeks, we don't know, they can adapt the bird vaccine and turn it into a human vaccine. They're very optimistic. However, you must realize that medical devices take a long time, and you need a lot of testing to be done to be sure they're safe. But they feel that they're very close to a breakthrough. And of course, here in Israel, we certainly are hopeful that we will be the first country to have a vaccine for coronavirus. It would be wonderful, I mean, obviously.
I'll just add to that. So there's several efforts right now trying to focus on drug repurposing. That's the concept of taking known drugs and seeing how they affect other diseases. So as Israel has been collecting data since the 90s, of course, in a most private way by the HMOs, though the HMOs have been collecting the data since the 1993 in a digitalized form. If you can think about it, we were doing clinical experiments on ourselves as patients. And today the HMOs have access to this, and several researchers working with Maccabi Institute, the Lt Institute, are trying to identify drugs that are being used by all of us, already passed all of the FDAs, and seeing whether they can be used, for example, for coronavirus based on the first information that we're getting from some of the first patients.
Terrific. Our next question is an interesting one, and Avital, you may be able to answer this one. Given that specifically Gaza is so tightly packed together in terms of its population, are there fears that an outbreak of the coronavirus in Gaza could have larger implications on Israel?
So actually, I would say the good news is that Gaza actually has not been affected as of now by the coronavirus. Unfortunately, in the West Bank, I cannot say the same, because a group of pilgrims who visited Bethlehem churches in that city, I think they came from Greece and maybe some other countries, apparently had the coronavirus when they were on the ground visiting. So therefore, that actually spread a little bit. But I can tell you that yesterday, Israel actually shipped different kinds of tests for the coronavirus to both the West Bank and Gaza. And I can also share with you that the Israeli President Rivlin, earlier today, called Mahmoud Abbas, Abu Mazen, the head of the Palestinian Authority, and offered help in case they would need it. So I think overall it's the interest of Israel, of course, to help the Palestinians and make sure that the spreading of the virus, I would say, is contained as much as possible.
Terrific. Our next question is for Dr. Landsberg, because it is a clinical question. And a few of our callers want to know if one gets the coronavirus, if you could be reinfected after getting better.
Yeah. So there are two answers to that. The first one is that we don't actually know. And the second answer is probably not. Almost all viral infections of this type, it's a once-off. You know, once you've had measles, you're not going to get it again. And probably once you've had coronavirus, you're not going to get it again. But remember, this virus, we've known about it only since the beginning of December 2019. That's 4 months. And it's not enough time to know if somebody's going to get it again, but more than likely not.
Great. Terrific. Avital, this might actually be another question for you. It's about sort of medical diplomacy, and is there an opportunity to advance peace in the region by leveraging Israel's science and technology to bring about a lasting peace more broadly?
Well, I'm a very optimistic person. If I'm just reading the headlines that opened our day here in Israel, basically the headlines spoke about some sort of a secret operation of the Mossad, who were able to get and buy a large amount of tests for the virus from another country in the region that Israel doesn't have formal or diplomatic relations with. So I think this is a very good reason to be optimistic. Look, there are scientists all over the area, all over the region. I don't see any reason for not cooperating with other scientists. On the contrary, this is a good opportunity to further expand on relations beyond security, beyond energy, and we are in a path to formalize the relations with other countries in the region. They take 10 years, 15 years, but I think we're on the right path there.
Terrific. And we'll take one more question, which is from Samantha Marks in Chicago. And Samantha asks, the United States, Israel, and every other country with this virus has vastly different population sizes and healthcare systems. How are countries working together to scale accordingly and address different needs? For instance, Israel has a lot of Holocaust survivors. Are there any efforts specifically addressed at helping those populations? Dr. Landsberg, to you.
Okay, so certainly the big difference between different countries is the amount of elderly people you have, which is going to be a critical factor about how many people are going to really sick with coronavirus. Remember that young people in general have a very mild illness, and hardly anybody under the age of 30 has become seriously ill with coronavirus. Most of the serious cases have been over the age of 70 or 80. And here in Israel, we do have a lot of Holocaust survivors. Community, we've been using outreach programs to Holocaust survivors. We're a highly computerized medical system. We actually know every one of our Holocaust survivors has got a certain code in the computing system. And we've been making sure that volunteers have been going out to their houses to check that they're okay, bringing them medications for the next while, even food packages. It's pretty well organized. And again, we're very sensitive to this issue. I'm not sure if that's the case in other countries. I know in Britain, for example, they've just told elderly people just to not go outside, stay inside. And Italy, unfortunately, they really missed the boat, and they have a lot of mortality there. So I think you have to look at the elderly, Holocaust survivors, but all elderly populations, and think about how you're going to take care of them and keep them safe.
Great. Thank you, Dr. Landsberg, and Dr. Radinsky. Maybe a final sentence from you about the essential part that technology really plays in a virus like Corona and others. Just a summarizing sentence from you.
I think that we always had very strained healthcare systems when we don't have enough doctors. There's a shortage of around $60,000 to $90,000 in the United States alone. And we've been building tools to start automating some of their work to build better decision support systems, etc. But now, during this pandemic times, actually leveraging all of this data that we obtain from patients and building a coherent map of what's going on and how it can actually serve decision makers. It's actually taking all of the knowledge that Israel has been developing for years based on its digital medical records in the army, etc. And finally, these technologies have the power to actually help and save lives.
Amazing. And as you said before, this technology could be adopted by the entire world. I do have two closing messages. One, for all our listeners, today, AJC launched its newest communications campaign, #BeAMensch. For those who don't know, mensch is an Yiddish word for good person. In the face of the chaos and uncertainty that we're facing now with the COVID-19, we do invite you to help us showcase acts of kindness and decency. There are plenty of opportunities to hashtag #BeAMensch, and for more information, you're all welcome to go to ajc.org/BeAMensch. And I do want to end on an optimistic note. Approximately an hour ago, tens of thousands of Israelis were standing in their porches and their balconies in their homes from south to north, applauding for a long time for all the medical teams that are saving lives, researching 24/7 just to get us through this situation and uncertain times. So with that optimistic note, I do want to thank all of you, the members of the AJC community who joined us today. We will be offering additional programs like this in the coming days and weeks through Advocacy Anywhere. You can stay connected by visiting ajc.org. I wish you all to be safe and healthy. Thank you, everybody, and shalom.
Shalom.
Thank you.